Madam Chair, ladies and gentlemen, first of all, Claudia and myself, we're both messengers of love. We're both wearing red, so to put this on a more positive note, I think there's good emotions here on both sides. Let me just see, all right. Now, she tried to convey the message, oh, it's all about South and North, and particularly in Africa, we see these trials with this increase in blood pressure, and you may also know the advanced trial where, not in the first 2 years, but subsequent observations led to some subtle differences. But always remember that you're comparing weight-suppressive regimens with weight-independent regimens, where you're going to gain weight because you come back from an untreated HIV infection to a better health control. And that is something I think we should keep in mind, because then the end of the question is it really the drug, or is it just a difference in a weight suppressive regimen or controlling HIV replication? And taking studies where you say if you don't have HIV, you're not going to get hypertension, no, because you're going to die from HIV in the end, then probably taking medicine is the better way forward. Now, who do you think is the true expert in weight gain and hypertension? Let the pictures speak for themselves. You have a beautiful South American lady with a lot of tango and rhythm, and then you have me. The only one who remains wanting to cuddle with me is the dog, because dogs love you independent of your weight issues. All right, and if you look at the evidence, the data, wow, look at all the phase 2 and 3 dolutegravir studies versus combination antiviral therapy. There are really only very subtle differences in blood pressure changes over time. There was no signal of increase of hypertension or a higher need for medication in these individuals. Think of the famous NEAT study where they looked at the incidence of hypertension and blood pressure changes in people living with HIV who were at a high risk for cardiovascular disease. So this was an older patient population with a higher prevalence of hypertension. And when they were switched from a boosted PI to dolutegravir, there was really no signal of any change, as you can see in the figures, in systolic or diastolic blood pressure over time, really suggesting there is no drug-independent property leading to blood pressure increases. And probably one of the strongest pieces of evidence came from this year CROI, where there was data from the HPTN study looking at cabotegravir in the setting of pre-exposure prophylaxis. And you can see, indeed, by different regions, and also note on the right-hand side, Latin America. That's where Claudia's from. Is there that tremendous signal of hypertension? No, there isn't. The curves overlap, and so this second-generation integrase inhibitor was not associated with any increase in blood pressure different from TDF-FTC, which was the control arm in this study. Note that there is a higher prevalence of hypertension in the United States and Africa over time, highlighting that we have to address these issues. And in a world we're talking about sustainable health goals, obviously addressing other issues beyond HIV are becoming increasingly important. Think of the also presented results of the IMPACT trial. That's a trial looking at dolutegravir versus efavirenz-based ART in pregnant and postpartum women. And if you see at the left-hand slide, you just see the absolute numbers. You see there's indeed a higher percentage of normotensive individuals on the efavirenz arm. But when you then look on the right-hand side, where the hazard ratios for occurrence of elevated blood pressure are depicted with the incidence of hypertension by arm, you can see that indeed it's really weight which is driving hypertension. And if you correct for or adjust for weight, and remember that's what you have to do in all these multivariate analyses, you have to adjust for the presence of risk factors, then you can see that there really are no differences between the different treatment arms. Again, I think sending a clear signal, there is really no own property of hypertension association with these integrase inhibitors. So if you look at the WHO information sheet, and that's great about WHO, they have information on all different kind of disease entities, you can see what is really contributing to high blood pressure. Well, it's older age, it's genetics, it's being overweight, obese, not being physically active, high salt diet, and drinking too much alcohol. Well, I know a lot about that. So saying there are other risk factors, and I think what our wonderful Madam Chair announced in the beginning that she wanted to talk to Lucy about, the need for increased physical activity, is depicted very nicely. That's, I think, where the direction is going. We all have to move more, including the humble speaker in front of you. So what does Claudia really think about hypertension? Some people speak with two voices. Don't forget that. So she is a lead author on very many practical guidance papers. Practical management of complexity in older people with HIV, approaching an international consensus, including people from those countries from the north. And what are they saying? Well, they're just saying that people are aging, and that with aging and having a normal life expectancy, you will have to manage other comorbidities. So it's a call, and I think that's what she's trying to say. HIV is an independent contributor to inflammation that has an impact on cardiovascular events. And so, as a good clinician, that's what she is, she's going to deal with these complexities. She also has a paper, Evaluation of Cardiovascular Risk in HIV-positive Patients in Santiago, Chile, where she practices. And what does she say? Well, antiviral therapy has changed the course of HIV epidemic. Yes, they live longer. As a consequence, the patients present the same medical conditions than the rest of the populations. Yes, everyone develops hypertension if all the WHO risk factors apply. So that's a clear message there. Now, what does the humble speaker in front of you do with hypertension? Oh, he worked in hypertension. And obesity and hypertension when he was still thin, believe it or not. In 1994, I wrote a review on obesity and hypertension, foreseeing that something was going to happen down the line of my life, following the frustration of lovers not wanting to engage with myself, eating potato chips with my dog. Yeah. And what does that highlight in this article? It's all about that there's increasing evidence that weight increases are associated with increased blood pressure. So I think that's what we have to take into account, and clearly this is the issue we need to address. So stop blaming others for your problems and move to a healthy lifestyle. Thank you very much.